Welcome to the Saul's Newsstand News Review for March 15th, 2019. An article from the Motley Fool states, "Why taxing the rich isn't a Social Security cure-all. The most popular solution to fix Social Security may not get the job done. Ready or not, Social Security is in trouble. Although its Judgment Day changes frequently, the past 34 reports from the Social Security Board of Trustees, dating back to 1985, have shown that the program won't collect enough revenue over the next 75 years to cover expenditures. The reality, though, is that taxing the rich isn't likely to be a cure-all for Social Security, even if it does provide an immediate lift in taxable revenue. The first problem with taxing well-to-do workers is that it ignores a trend that's persisted since Social Security was signed into law in 1935, increasing longevity. As a result of easier access to medical care, better pharmaceutical products, and improved health education, life expectancies have been on the rise over the long run. Finally, we have to remember what happened when the wealthy had significantly higher marginal tax rates imposed decades ago. Despite peak marginal federal income tax rates of 70 to 90%, most rich Americans avoided an effective tax rate of anywhere near this number. Yes, tax loopholes helped, but the response by the wealthy to shift their earned income made an arguably bigger difference. The Washington Examiner is reporting, hospitals warn Medicare public option would be an $800 billion hit to industry. Hospitals warned Tuesday that their industry would suffer an $800 billion cut if Democrats succeeded in massively expanding Medicare. The American Hospital Association and the Federation of American Hospitals published a report concluding that allowing the public to buy into Medicare plans at cost would not only contribute to massive budget cuts to hospitals nationwide, but would also jeopardize patients' access to care. Democrats have several proposals for extending Medicare. The most aggressive option, the Medicare for All Act, introduced in the last Congress by Senator Bernie Sanders, would enroll everyone in an expanded government-financed health care plan. Another less ambitious proposal would turn Medicare into a public option, allowing others besides seniors to buy into it. The hospitals are prepared to fight the measures. In a press release, Tom Nichols, AHA Executive Vice President, said, "It is not practical to disrupt coverage provided through employer-sponsored plans that already cover more than 150 million Americans. America's hospitals and health systems remain committed to working together with policymakers to help expand coverage and reduce costs for all Americans. However, a Medicare for All approach would impede, not advance, our shared goals." And finally, USA Today reports, only 3% of Social Security recipients are taking advantage of this benefit-boosting move. Millions of seniors collect Social Security in retirement, and for a large number, those benefits spell the difference between staying afloat financially and teetering on the edge of poverty. Given the important role Social Security plays in so many seniors' lives, you'd think more people would be taking steps to secure the highest monthly benefit possible. But in reality, only 3% of eligible recipients file for Social Security at age 70, which means that the overwhelming majority of beneficiaries aren't maximizing this critical source of income. It matters when you file. Though your Social Security benefits are based on your highest 35 years of earnings, the amount you wind up with each month will depend on how old you are when you file for them. If you file for benefits at full retirement age, or FRA, you'll get the exact amount each month that your earnings history entitles you to. You get an 8-year window to file for Social Security that begins at age 62 and ends at age 70. Filing at 62 means getting your benefits early, but it also means reducing them substantially. We would encourage you to read the full article by clicking on the link in the description below. And that concludes your Saul's Newsstand News Review for March 15th, 2019. For more political news faster, visit saulsnews.com.